I'd like to bring to the stage one of the hardest working, level-headed, compassionate, and passionate leaders I have ever had the pleasure of working with on the American College of Healthcare Executives Board of Governors. We worked closely together through the onslaught of COVID-19. I still have the text to prove it. And it is my distinct honor to award him the 2022 Gold Medal Award. As you may know, the Gold Medal Award is ACHE's highest honor, bestowed on outstanding leaders. It is awarded to those healthcare executives who embody leadership excellence within their organizations and outside the four walls. They continuously serve the patients that we're privileged to care for. To determine the annual recipient of the Gold Medal Award, we rely on the judgment of special committee charged with recognizing exceptional achievement in the areas of leadership and executive performance, healthcare service delivery, education, management and organizational development, and health-related community activities. This year's recipient, Michael Focina, has excelled in all of those areas and more. When Michael Focina was preparing to lead ACHE as new chair in 2020, remember that? Remember those days? He also was following an epidemic that would soon metastasize into a pandemic. The hospital he led, New York Presbyterian Lawrence, would soon provide initial treatment to the first known hospitalized COVID-19 patient on the East Coast. After he was installed as chair in March of 2020, he stepped into a very different and unprecedented role. Shortly thereafter, the ACHE Board of Governors held an emergency meeting and canceled the Congress on Healthcare Leadership for the first time in more than 65 years. During this turbulent period, Michael's leadership abilities were needed not only in his hospital, but for ACHE. He led New York Presbyterian Lawrence through every surge. Remember all those? Developing and executing plans, converting space into ICU bays, closets into ICU bays, constructing COVID-19 units, and shutting down ORs to comply with executive orders. Never get ahead of the governor. Colleagues have commented his efforts to blend the health system's demands with the needs and safety of his staff were exceptional. His time as ACHE chair also was unprecedented in the organization's history. Yet Michael worked to ensure it remained a source of leadership and a conduit of vital information. He adapted the methods of connection, working with ACHE management to adjust timeframes of educational credits and credentials. His healthcare peers recognize Michael for his ability to communicate clearly and unequivocally, which allows people to trust him and rely on his perspective. They say he is a wealth of knowledge, and that many rely on him for his counsel. I know I do. Michael took on roles of increasing responsibility at New York Presbyterian over the past 36 years, serving as president of New York Presbyterian Lawrence Hospital and senior vice president, New York Presbyterian from 2015 to 2022. He had overall responsibility for the 288-bed hospital, as well as Lawrence Home Care in Westchester, Janssen Hospice and Palliative Care, and the Bereavement Center at Westchester. During his tenure, the hospital opened a state-of-the-art cardiac catheterization lab, expanded its orthopedic, neurosciences, vascular, obstetrics, gynecology service into new markets, and he opened a comprehensive cancer center. He has been a member of ACHE for more than 20 years. In addition to his service as chair from 2020 to 2021, he served as chair-elect and immediate past chair. Michael has already received the ACHE Senior Level Regent Award, the Service Award, the Distinguished Award, and the Exemplary Service Award. Although Michael has achieved great success, he still maintains unwavering integrity, humility, and continuing commitment to improving himself and humanity. He credits his success to an extremely supportive and engaged family, and he has also inspired a larger family his legions of colleagues to advance their careers and serve in the healthcare profession, for his dedication to advancing healthcare excellence and commitment, to developing future leaders. The Board of Governors of the American College of Healthcare Executives is pleased to bestow the 2022 Gold Medal Award to Michael Facina. Michael, please come and slip them.
Wow. I don't know what else to say other than that. Carrie, thank you very much for that. It is humbling to have my fellow professionals on the committee decide that I am truly worthy of such an award. It means so much to be recognized for over 30-plus years of service in our wonderful profession. Because to me, the goal of healthcare executives is to improve the health status of our local community and to be a trusted partner. And I think that's something that we as healthcare leaders do every day. I know many of the previous recipients of this award: Chuck Stokes, Christine Candio, Ken White, Rich Cordova, Di Smalley, Gail Capozzolo, Roland Stacy. All of them are celebrated leaders in our industry. And to be put into a category with them, there is no other word for me than humbling. You guys really are our leaders of our industry, and I'm happy to follow you. ACHEs give me a valuable network of people, colleagues, and mentors. And I'm the fortunate beneficiary of their knowledge, their wisdom, and their guidance. Before I became a chair officer, I had the fortunate opportunity to talk with Dave Olson, Chuck Stokes, Ed Lamb, Rich Cordova, who were all board chairs when I was governor. To be able to talk to them about leadership, about things that were happening in our industry and in our local communities was something special to me. I am honored and appreciative of the time that they took. Thank you very much. But no one ever gets where they are alone. And I want to tell you two quick stories of two people who've changed my professional life. Out of college, I got a job at the former Columbia Presbyterian Medical Center working in the cardiology department to put on Holter monitors. I didn't know how to read EKGs when they hired me, but they hired me anyway. They handed me a book on how to interpret EKGs. I'll never forget it. It was an orange soft cover book that all the cardiology fellows had to read. Rapid Interpretations of EKGs by Dale Dubin. And any cardiologist in the room has probably read that book. But I had to read it, I had to understand it, and they spent a significant amount of time teaching me how to read EKGs, how to put Holter monitors on patients. About a year later, I got called into the division chief of cardiology's office, J.T. Bicker. He was an internationally renowned leader in cardiac arrhythmia research. And I wondered, why is he calling me in to talk to me? Well, I went into his office and he said, Michael, I've been watching you. And this is not what you should be doing for the rest of your career. He said, you need to advance yourself. I'm 23 years old, and I said, okay, that's fine. And he says, okay, I'm glad we agree. He said, I set up an appointment for you to see the Dean of the Graduate School of Public Health. And I said, okay. So he then says, well, why are you still sitting there? Get up, let's get going. He's waiting for you now. To make a long story short, he got me thinking about graduate school. And I ended up working during the day and going to school at night. I got my master's in public health. And then I did an administrative residency at the New York Hospital Cornell Medical Center. So I was working at Columbia and Cornell all pre-merger. Had that senior executive, Dr. Bigger, not taken an interest in me, had he not seen my work ethic, my interest in learning, the diligence in the work that I did, had he not told me I needed to advance myself, I don't know what I would be doing right now. It was a pivotal moment in my life. I always had an interest in learning and doing new things, and he recognized that. That short 5-minute conversation changed my life. I learned more about the industry from other senior leaders that I've worked with along the way. I've had many mentors. One of my early mentors was George Vecchione. Gail, I know you know George very well. He was the Executive Vice President and Chief Operating Officer at the New York Hospital at the time, and he hired me on as administrative resident, and then after that into a staff position. About a year or two later, we were talking about industry and careers, and during our discussion, he said to me, and I'll never forget it, Michael, I've opened the door for you. Now it's your job to open the door for the next generation. Which brings us to why we're here today and why we're all members of ACHE. It is for our professional growth, for our networking, and our mentorship. You can see how mentoring helped me early in my career. Because of those two senior leaders, very early in my career, who had taken interest in me, which is why I worked so hard to give back to our profession and back to the next generation. ACHE has been a valuable instrument in helping me expand that. Each and every one of you out there have benefited from the experience of those who have come before you. And all of us have the opportunity and the responsibility to pass along our knowledge to the next generation of healthcare leaders. I believe it is incumbent upon us to share with others. The wisdom, the advice, counsel, and conversations of those in ACHE and around me have certainly helped me when my hospital had one of the first recognized COVID patients in New York and on the East Coast. To be able to reach out to colleagues such as Carrie, who was actually in Georgia at the time, Sal Torres, who was in Philadelphia at the time, or Jared McGee, who was our regent for the Army, who came in from Texas to open up the Javits Center in New York. Those were powerful and helpful relationships, and ACHE was the vehicle to help me to get to know people across the nation and share information about what we were learning in New York during those very early days. This will not be our last pandemic or our last health crisis we will face, and educating our next generation of leaders is what ACHE is all about, and that's what senior leaders are supposed to do. We need to be present in our facilities and with our staff. Throughout my career, I was part of a team that helped merge the two academic centers, and then I was responsible for merging in 3 other hospitals into our organization. I ran a hospital during the 9/11 attacks, during the Northeast Regional Blackout, Hurricane Sandy, and then 11 months before our COVID crisis, my hospital had an active shooter. It was Sunday night. I was sitting at home at 9 o'clock at night, and I got the call that said there's somebody with a gun in your hospital. And I got up and go, and my daughter Amy, who's sitting here, said, "Dad, where are you going?" I said, "Well, I got to go to the hospital." She said, "No, but they just said there was somebody with a gun in the hospital. Why can't you do it from here?" And I said, "I can't. Because as the leader, you have to be present. You have to be there with your staff. They need to see you. There is a crisis. They were concerned. They need to see their leaders." It worked out fine. There were no injuries, no incidents. It worked out fine, but it's one of those emergent issues that crop up. And then 11 months later, we had our COVID patient. It's been quite a career, for sure. But the importance of mentorship is more critical now than ever as we fight this global pandemic and our industry rapidly evolves and changes. And I ask the senior leaders in this room to mentor an early careerist, to give them your thought process, how you think through solutions in helping your patients in your hospital and the residents of your community. Impart your wisdom to the next generation of leaders. Our industry and our nation depend upon it. To those middle careerists and early careerists, find a mentor, a colleague, a friend that you can bounce ideas off. That's what I've done throughout my entire career. Don't be afraid to take on an assignment in an area you are unfamiliar with, or ask a question or make a mistake. We all have. And as they say, if you get knocked down 8 times, you get up 9. You be resilient. That's how we learn. We've been in quite a learning mode over the past several years, and I would be remiss if I didn't acknowledge and thank those, as Carrie did, in our industry who helped face this challenge of this global pandemic and helped us get to where we are today. Without your steadfast leadership, we would not be on the road to recovery. And finally, there's some very special people in my life that have spent time molding me and teaching me core values to live by, and those would be my parents. I'm very thankful for my parents and my siblings. My dad probably has more wisdom than anyone I've ever met. I've tried to emulate his common sense approach to things and his calm consideration for any challenge. My mom has a heart of gold and always jumps in to help people in need. My mom and dad have always been there for me, and I am most grateful for their love and support. They unfortunately couldn't be here today and are back home in New York. Secondly, I also owe so much to my wife, Linda, who many of you know. If you're lucky enough to marry someone because you have the utmost respect for them and who they are and how they think, then I'm the luckiest guy around. Because Linda is truly a partner that I can rely upon, and some sound wisdom that she gives me is always helpful. She's a wonderful wife and mother to our 3 children, Amy, Stephanie, and Christopher, who are all here today. It's amazing what you can learn from your children, and my kids have taught me a lot. Amy, Stephanie, Christopher, thank you for being here today. I'm so proud of each and every one of you. Linda, you're one of a kind, and I want to thank you for your love and support. And finally, to the ACHE and the award committee, I want to thank you for this wonderful honor. It truly is very special to me. To our attendees, I hope you enjoy this year's Congress. I hope you connect with somebody new who can be part of your active professional network. Our future is bright. Thank you.